In 2008, 7.6 million people died of cancer. About 70% of these deaths occurred in developing countries like India. If this trend continues, an estimated 13.1 million more people are going to die in the year 2030.
We see approximately 10 lakh new cases of cancer a year in India.
Overall incidence of cancer is definitely going to rise.
In India, the head and neck cancer has become a major worry because of tobacco chewing.
No age is immune to cancer.
And it's a big challenge, and it has to be met with by more modern technology.
According to the World Health Organization, cancers of major public health relevance, such as breast, cervical, and colorectal, can be cured if detected early and treated adequately.
Say maybe 20 years back, the patients who were coming to us were in a very, very advanced stage, and the diagnostic modalities were not that accurate, not that up to date.
But in 2002, the new equipment, the PET-CT scanners, which came into clinical practice, have made the detection of cancer not only affordable but easier.
PET-CT helps us to correctly stage the disease, find the disease at places which has not been seen by other conventional imaging modalities.
You will need PET-CT at staging, at restaging, for evaluating treatment response, either it's after radiotherapy or after chemotherapy, and in some situations even in follow-up.
PET-CT has now become a part and parcel of the entire management spectrum. So you cannot treat a cancer patient today without a PET-CT.
In 2006, Philips Healthcare introduced premium standards in imaging through their time-of-flight technology, a boon to cancer management. It is an advanced imaging technique that is now being used regularly by physicians to detect the spread of the tumor more precisely, faster, and surprisingly, subjecting the patient to just half the dose of radiopharmaceuticals like FDG, thus ensuring minimal radiation.
Time of flight scanner. We actually mean very, very precision, very high level of identifying the time intervals, and therefore picking up we are able to position exactly from where this particular radiation originates.
Time of flight is a technology by which the entire sensitivity of a PET-CT is enhanced, leading to shorter scans, better scans.
Scientifically speaking, it tells me where exactly the annihilation has occurred. But in practicality, it helps me to do more number of patients in terms that I can give a much lesser dose and do more number of scans.
The time of flight technology allows us to do scans with almost 1/3 to 1/5 the dose of FDG which we used to use in the traditional PET-CT scanners.
Even if we have to repeat the scans often, the radiation, which was a major issue with the older generation, is now almost reduced significantly.
Similarly, because you handle less radiation, the radiation workers who work on the department also are exposed less.
So if you have a technology by which you are going to use lesser amount of FDG, and you may, or for the same amount of FDG you can do more amount of patients, or you can do the scans faster, so in a given time you can actually do more scans. All these things relate directly in several ways. For the owner, it increases the profitability. For the patient, since the consumable cost goes down, the net cost of the scan becomes less.
Image is produced very fast, within 8 to 10 minutes. Each patient study can get over maximum by 12 to 15 minutes.
We can make a diagnosis and staging of the cancer within 3 days, and the treatment can start on the 4th or 5th day.
Even with late-stage cancer, the suffering of patients can be relieved with good palliative care. Rapid improvements in the speed of PET-CT crystal technology enables quick and efficient scanning. The patient goes home at ease, the doctor's level of confidence in reporting rises remarkably, and the whole focus can be kept on pain relief and radiation control.
Many patients during the course of their treatment have to undergo multiple PET-CT scans. Now, these patients, many of them have had scans done at other non-time of flight machines. And when they come and get their scans done at the TrueFlight Select, they are amazed. They are amazed because these scans take so much lesser time. They are amazed because it's an open machine. An attendant can stand inside and hold their hand.
We have not come across a single patient who has complained about claustrophobia.
The time is very shortened. I am not in the tunnel for a long time. And number two, very sick and ill patients, we cannot keep for a long time inside. We have to bring them out fast.
The waiting period for the patient today, what used to be around 10 to 15 days, is just now maximum a day or two.
This machine involves very little radiation, therefore it's very safe for women as well as children.
Child patients where we wanted to avoid movement related artifacts.
Especially in obese patients where the scan quality decreases and we have to give larger number of activity with the non-time of flight machines. With this machine, with the same amount of activity, the resolution that we get in obese patients is particularly very good.
The first time-of-flight PET-CT by Philips came to India in 2008 at the Ruby Hall Clinic, Pune. Subsequently, being adopted by a multitude of distinguished names in the medical fraternity. In these 5 years, the time-of-flight evolution has truly revolutionized PET imaging in oncology, from identifying symptoms to effective prognosis. Be it the first generation to third generation of Gemini Astonish TF, Ingenuity TF or the TrueFlight Select.
When I went to Dr. Grant with the 3 options available, he said that, "Doc, buy the best." And we decided to buy time of flight PET-CT of Philips.
When I came to know that Philips has introduced the time of flight system, I was very much in close contact with the department that this machine was installed in Pune, and then I was very keen on having this time of flight system.
I feel very proud to be first user, because after it got installed there were very many visitors who kept on pouring in to actually see the technology. We were doing to the tune of maybe 60 cases a month. Now, 5 years down the line, we are doing 400 cases a month.
In Tata Memorial Center as it stands today, we are scanning anywhere between 50 to 70 scans, 50 to 70 patients, undergo what's called as whole body cancer scans in a day on time of flight system.
Since its arrival in India in 2008, the time-of-flight technology has been the first preference of all the government and institutional hospitals. 18 of 33 time-of-flight PET-CT systems in India are from Philips. A few are functional and another few are soon going to be functional. No wonder. Philips has rightly been proved as the market leader and a true partner of choice today.
And equipment is only as good as the maintenance it gets. Now with Philips, we've had an excellent support both from on-site engineers as well as from the online support which we get.
Philips team has always been very quick and supportive.
Philips has been part of this institution right from the early days when the equipment was being planned, in the layout planning, in seeking approval from the authorities, in the actual installations, and now that most of the equipment is installed and running, in the upkeep and the maintenance of this equipment.
All the engineers are quite young and very active and fairly well knowledged, both from the point of view of software programs and also the hardware issues.
TrueFlight PET-CT Select, which is installed here at the department, has had an uptime of almost 100%.
I think Philips team did an excellent job. Right from the time they executed the installation, the quality assurance, the NEMA tests, and even whenever we had some small hiccups with the machines, Philips made good root cause analysis, solved the problem, And we have 2 solid systems, and that's why we are able to do on an average between something like 60 to 65 scans a day. Such big numbers is not so easy to achieve. You have to have a dedicated team of doctors, technologists and support system, but very important that you should have good machines and the people behind the machine. And I think in that way Philips has lived up to its promise in a big way.
Philips is distinctly the world leader in the time-of-flight technology and yet continues to push the envelope of PET imaging performance.
The time has come.
It's time to fight cancer.
And we can definitely win over it.
The promise of much better PET imaging.
With time of flight, we are ready for the challenges of tomorrow.
The cancer conquer is a possibility now.
Because when it comes to cancer, there can be no compromises.
Time of flight, a promise of premium standard in PET-CT imaging. By Philips Healthcare.